Communities across the country are waking up to the dangers posed by tuberculosis, thanks to a massive program for advocacy communication and social mobilization, or TBA-CSM, funded by USAID and implemented by World Vision with NGO partners in 13 states. In each of these states, the partners selected some innovative practices to spread the message about TB. Here, in Sundarbans, Sheesh adapted its floating hospitals to create awareness. Prahlad, a traditional baul singer who would normally sing of divine love and mysticism, would travel in the boat to the islands, urging people to go for sputum testing if they have cough for more than 2 weeks. Here, in these far-flung areas, people do not have access to any government medical services.
People, they do not have informations. In lack of informations, they are not able of performing their many things. So this ACSM project is a unique project to us. We are reaching to the people with our boat, with informations.
The TBA-CSM was implemented from 2008 for 2 years. The boat, adorned with colorful banners and slogans about TB, attracts attention wherever it goes. As it sets anchor on an island, the doctor looks out for symptoms of TB on patients who come to him for a medical checkup. If he finds someone has TB symptoms, he prescribes sputum diagnosis. An ACSM volunteer then counsels the TB suspect on the precautions to take and gives them information about where to go for sputum diagnosis to the nearest designated microscopy center. He issues a referral slip with the suspected TB patient's name and other details. The slip will be presented to the lab technician at the DMC and helps in tracking of the patient throughout his treatment.
রোগী আসলে আমার কাছে আমি জিজ্ঞাসা করি যে আপনার কাশি হয়েছে কতদিন, কাশির কথাটা শুনে নেই। উনি যদি বলেন 2 সপ্তাহের বেশি কাশি হয় তো হচ্ছে, সন্ধ্যার দিকে জ্বর হয়, খিদে কমে যায়, তাহলে ওনাকে আমি সরকারি হসপিটালে পাঠিয়ে দিই।
This way, in all the states, suspected TB patients are being identified and persuaded to go for sputum diagnosis to a government facility through such innovative practices. While the floating hospital is unique to the Sundarbans, other practices which were used successfully during TBA-CSM include cured TB patients in 3 districts of West Bengal by Sheesh and 6 districts by GLRA. Referral mechanism involving ASHA workers and private practitioners in 10 districts of Madhya Pradesh, implemented by Lepra India. Information kiosks in Bihar, implemented by ADRA India in 8 districts. And mobile van film shows in Andhra Pradesh, implemented by TB Alert in 5 districts. The focus of all these awareness activities was the same: to spread the message that any cough which is 2 weeks old is a symptom of TB. TB diagnosis should be done through examination of sputum only at a government facility, and TB is curable through DOTS. Volunteers sought to drive home the point to communities that they should remain alert about the symptoms in themselves and in their neighborhoods. Cured TB patients used referral slips to refer suspected TB patients in their homes itself. Since they double up as DOT providers, they are then able to keep track whether the patient went for sputum diagnosis or not. They also provide support to the patients once they go on DOTS, counseling them through their own experiences.
ওষুধ খাওয়ালে বমি করে যদি ফলে সেই ওষুধ ধুয়ে পেশেন্টের খাওয়ানো হয় রোগীর।
ASHA workers in Madhya Pradesh go a step further. While referring a suspected TB patient to the DMC, they also hand over a sputum container so that the patient needn't go twice to the DMC. He can take along a morning sample and give the spot sample at the DMC itself.
आशा बहन जी ने हमें डिब्बी दे मतलब सबे हम खकार लेके जहाँ पे आ जहाँ में डॉक्टर साहब दे दी, हमें दोबारा नहीं भागने पड़े।
चेस्ट सिम्टोमेटिक अभी हमारे पास सेल्फ मोटिवेटेड बहुत नॉमिनल केसेस आ रहे थे, ओनली 70% केसेस ही हम पकड़ पा रहे थे। आज आशा के इन्वॉल्वमेंट से ट्रेनिंग के पश्चात हमारा मतलब 100% का टारगेट हो वो पूरे होना जा रहा है।
Private practitioners have also now been roped into the referral mechanism through sensitization by lepra and state TB authorities.
जब से लेप्रा ने यहाँ पे हम लोगों को ट्रेनिंग दिया है, ट्रेनिंग देने के बाद से हम लोगों के लिए बहुत इजी हो गया है कि किसी भी पेशेंट के लिए यदि हम डायग्नोस करते हैं या उसको लगता है कि उसके सिम्टम्स ट्यूबरकुलर से मिलते जुलते हैं, तो यहीं पे हॉस्पिटल में अवेलेबिलिटी है इनकी खकार की जांच होने की, स्पुटम के टेस्ट होने की, तो यहीं के पेशेंट को भेज देते हैं उनके स्पुटम के टेस्ट के लिए, यहीं पे डॉट्स उनके लिए अवेलेबल हो जाता है.
The practice adopted in Bihar, the information kiosk, helped in reaching out to a mass of people at the same time. The kiosk is usually set up at crowded places like near a hart or weekly bazaar and venue of a street theatre, and attracts hordes of curious people and children. They are then asked if they or any of their relatives or friends have symptoms of TB, and if they do, how it is important to go to a DMC for a checkup. Young Himanshu has been identified at the kiosk itself as he has coughed for more than 2 weeks. He has been referred to the nearest DMC.
हमने ये इम्पैक्ट देखा है कि मेरा केस डिटेक्शन रेट कुछ बढ़ रहा है और जो पेशेंट्स कॉन्शियस हो रहे हैं वो आते भी हैं, कहते हैं कि हमें फील्ड से लोगों ने मोटिवेट करके भेजा है कि जाओ बलगम जांच कराओ.
We make it a deliberate attempt to also include women into it so that when they hear, they can internalize the message and they can pass on the message. We also include the community health workers like Anganwadi, Asha, because at the end of the day, they have to get connected with these community health workers.
Mobile van film shows use entertainment to draw the attention of the communities. Here in Andhra Pradesh, TB Alert also targeted focus groups and school children to spread TB awareness. They are shown a film on TB and HIV. The van attendant, who is a trained social worker, then talks to them to gauge how much they understood about TB.
చాలా మంచి పని మాట. ఎన్ని కోట్లు ఫండింగ్ ఖర్చు పెట్టినా ఇది ఒక మహత్తరమైన కార్యక్రమం. ఈ కార్యక్రమం చేయడం వల్ల చాలా మంచిది ప్రజలకి. చాలా మెసేజ్ పోతుంది. పక్కా స్లమ్స్ ఉన్నాయి, అంత ఇంకా అవేర్నెస్ లేని ఊర్లు కూడా ఉన్నాయి. దీనివల్ల 100% అవేర్నెస్ జరుగుతుందన్నమాట ఈ ఫిల్మ్ షో వల్ల.
The main show is in the evening at the village square when the farmers have returned from their fields and the families find time to come and watch the film together or with their friends. After the show, leaflets are distributed which contain the addresses of the DMCs in the area. Sometimes the volunteers also come across persons with symptoms of TB.
We get 30 to 40 referrals per month per district. Among them, 10 to 15 will be from these film shows. And more importantly, the people who attended to these film shows, they will go back to their homes, discuss with their family members, neighbors and the relatives also. From them also we can get the referrals through groups and our NGO partners.
The details of the suspected TB patients identified here at the film shows as well as in all other states are shared with the district TB staff. The ANMs and the multipurpose health workers will also eventually get to know who is being referred and from which area. This way, a whole chain of persons keep track of suspected TB patients referred to the DMC till he or she comes on dot. The progress of the patient will be monitored till he is completely cured.
I am very excited. This experience has been exhilarating because working with partners was great. They are really great in the communities. Now through these promising practices, the base has been set and we have built relationship with the government which we can bank upon now in next phase of this project, which is being now funded by Global Fund Round 9 program.
So, the show may be over for now and it may be time to head home, but not before having been truly awakened to a scourge. Now, its time is up.
ఇనప్పుడు రక్తం పడడం, జ్వరం రావడం, బరుగు తగ్గడం.
যদি কারোর 2 সপ্তাহ কাশি হয় তার আপনার কাছে আমাদের এখানে স্বাস্থ্যকেন্দ্র আছে, খালিবা স্বাস্থ্যকেন্দ্র, এখানে পাঠানো।
टीबी के बारे में जाननी है कि 2 हफ्ता से खांसी हुई तो हॉस्पिटल जाए के पड़ी।